Hello, welcome to the launch of the latest season of Emory University's Health Storytelling Project, which is a Q&A with authors of fascinating new books about health and science. I'm Maryn McKenna. I'm a journalist and author and senior fellow in the Center for the Study of Human Health, and I'm the curator and host of this series. In a moment, I'll introduce you to my guest, investigative journalist Jessie Singer, and her fascinating and deeply disturbing book, There Are No Accidents: The Deadly Rise of Injury and Disaster, Who Profits and Who Pays the Price. But first, let me tell you about this series. At least once per month during the academic year, we invite writers whose journalistic or academic books examine health, the science and history of health, and health's intersection with society. This series of conversations originates at the Emory Center for the Study of Human Health. We're also fortunate to have three amazing co-sponsors. They are the Georgia Center for the Book, which is an affiliate of the Library of Congress, Science Gallery Atlanta, which presents exhibits that live at the juncture of science and art and ignite creativity and discovery, and the much-loved Decatur Book Festival, the largest independent book fair in the United States. Book fans may know that the festival is taking a post-pandemic hiatus to rethink its goals and strategies. And in that pause, we are delighted to bring these authors in our series to the festival's passionate supporters. If you're coming to us from one of those sponsors, please let us know in the comments on whatever platform you're watching us on. Now, let me tell you who'll be appearing through the rest of this spring, since this is our first episode of the spring semester. Our theme in this half year is how our health is determined by forces and systems beyond our control, whether that's the built environment or the legal system, changes in weather and climate, or research agendas that choose what is and who is and is not studied, and how we negotiate those systems to protect our health, or how we don't. Tonight, as I mentioned, I'll be talking to Jessie Singer about her book, There Are No Accidents: The Deadly Rise of Injury and Disaster, Who Profits and Who Pays the Price, which is published by Simon & Schuster. On Wednesday, February 28th, I'll interview medical anthropologist Teresa McPhail about her book, Allergic: Our Irritated Bodies in a Changing World, published by Random House. And finally, on Wednesday, April 3rd, I'll be speaking to journalist and athlete Christine Yu about her book, Up to Speed: The Groundbreaking Science of Women Athletes, which was published by Riverhead Books. This series is live streamed on YouTube, Facebook, X, formerly Twitter, and archived on YouTube. We're all now also streaming live to Instagram for the first time. And one final note. If you're watching us on January 31st, you are experiencing a live event. And that means you can interact with us by commenting on YouTube or Facebook or replying on X, formerly Twitter. If you do, our producer, Stefan Kaplan of Spin It Social, will make sure we see what you've said and will put your question up on screen when I pose it to our guest. We apologize. We're working on comment integration for Instagram, but we don't have it nailed yet, and we'll be on LinkedIn comments soon as well. Do note that I'll turn to your questions in the second half of the 60-minute interview, but you can put them in at any time. We are happy to see them. And now let's turn to our book and our guest. So Jessie Singer is a trained investigative journalist and a frequent keynote speaker whose writing has appeared in the Washington Post, The Atlantic, The Nation, Bloomberg News, New York Magazine, and The Guardian, among others. She's an expert in safe systems, injury prevention, harm reduction, and the ongoing rise in accidental death, and is a senior editor at Transportation Alternatives, editor-in-chief of Reclaim magazine, and the founding editor of the International Vision Zero Cities Journal. The book we're going to discuss, There Are No Accidents, was selected as a best book of the year by the publications Slate, Fortune magazine, Mother Jones, and The Economist. Jessie, welcome to our series.
Thank you so much for having me.
I am really excited to talk about this book, even though it's an extremely grim subject, because I think, like everyone else, I've seen the news stories just recently about the incredible rise in traffic deaths and pedestrian deaths. And of course, if we look not at deaths, but at accidents, I don't think there's anyone who hasn't seen the news of the door blowing off a Boeing airplane, something that could have ended very badly. Now, we would tend, I think, to think of all of those as accidents, but your point, which is stated so beautifully in the very title of the book, is that what we consider accidents are actually something else entirely. And so I'd like to hear you talk for a minute about what those something elses actually are.
It's a great question because it's a question that I asked all of the hundreds of people that I interviewed for this book, safety experts in every field, and everyone had a different answer. And many of these people, safety experts, have long since given up the word accident, saying that it implies that what happened there was random and unpreventable, and that simply isn't true, so we shouldn't use the word. But the variation's interesting. The medical industry calls these adverse events. Workplace safety professionals call them incidents. I asked Ralph Nader what he thought I should call them, a man who investigated traffic accidents in the 1950s and gave us some of the most important safety innovations we've had in car design. He thought we should call them corporate homicides. But what we're talking about here, when we call something an accident, is to call something a predictable, preventable harm that we would prefer to pretend is random. Because that's what you see again and again, that these things that we call accidents, whether we're talking about an overdose death or a house fire or a traffic crash, have systemic corollaries. They happen to the same types of people in the same types of places. There's nothing random about them at all, to the point that you can plot them on maps and see that they always happen in the same areas of the country, in the same areas of individual cities. They track along racial lines and poverty lines. And so I like to say, instead of accident, that what we're talking about is predictable, preventable harm. Now, you might say, well, couldn't that include violence? Don't you think I need to say unintentional, predictable, preventable harm? And I think that's at the core of the problem. When we talk about accidents, what we're really saying is this was unintentional. What we're saying is I didn't mean it, or they didn't mean it. And we're sort of obsessed with this idea that the most important thing after something goes wrong is who's to blame. Who did something wrong or didn't do something wrong? We're defensive with ourselves. We're offensive with other people. And either way, we're trying to track this person. And I think that focus is at the core of the problem. We focus on who did what, and we miss the ability to solve problems in that sense. I'm going to tell you in a little while about the death of my friend and a terrorist attack. The solution to those two problems was actually the same for me in a way that I think really gets at how we misunderstand violence and so-called accidents. If we talk about an accidental shooting, something horrible, a child gets a gun, and a school shooting, the solution to those problems is the same. If we're willing to take a step back from our focus on individuals who may have done something wrong, and instead focus on ways to put barriers between people and harm's way. Locking away guns, restrictive laws on who can purchase them. Those prevent both the accident and the violence. We focus so much on intention when we talk about accidents, and it skips the potential for prevention.
So before we go further, there's one other question I want to ask about using this word accident. And that is that you chose to use it, right? Even though the book is an extended argument for how accidents, as we think of them, are not in fact accidents, but have not just causality, but some degree of intention or neglect behind them. You chose to settle on that word. Talk to us about why.
Oh, this was a hard decision. And it's a 250 some odd page book. And there were two drafts. One that included the word accident and one that replaced every one of those words. And when we're talking about, to be clear, when we're talking about accidents here, we are talking about unintentional injury death. We're talking about every way you can die in the US outside of disease and violence. And so that's fires and drownings and traffic crashes and drug overdoses and falls and a lot of other little things. And I called all of those things what they were in this one draft of the book. And I called them all what we call them most of the time in another draft, accidents. And while it was a hard decision, it also became easy when I looked at them side by side. Because if I didn't use the word accident, then it was a book about a million things, car crashes and drug overdoses and house fires. But if I used the words accident, then it became a book about why you and I think these are all the same or related when we care so much about the intention behind them or the neglect behind them or who did what and why. It became about why we obfuscate all of these things that we could prevent rather than a million little topics.
So a thing that's implicit in what you're saying, I support, by the way, not that you asked for my opinion, but I support your decision to go with the word accident because it's very clear, it's very familiar. And the fact that there's so much repetition of it throughout the text really drives home your point. But implicit in what you just said, that there are so many categories of accident, and you make this point early on, is that we members of the public don't necessarily have a good sense of how many accidental deaths and injuries there are because they fall in so many categories and because they mostly don't happen hundreds of people at a time. They happen 1 or 2 or 5 or a busload or a mine seam, but not enormous numbers. And so we may not understand that it is as profound a social problem as it is.
Yeah, it is not only a profound social problem. And just to give you a number, last year, 224,935 people in the US were killed in so-called accidents. And that leaves aside almost anything you would call a medical error. And also almost all accidental shootings based on 2, we can call them quirks of classification. So we're talking about huge numbers of people being lost to preventable causes. And I think that part of that is that what we're talking about is that, like you were talking about the Boeing door blowing off. Now imagine that plane had crashed, God forbid. It would be national news for months and months and months because 100, 200 people would have died at once. But most of these things we call accidents are not plane crashes. They're quiet deaths that happen in 1s and 2s. They're invisible. They happen in the privacy of homes. They're dealt with by 1 police car or 1 ambulance and they disappear. And there's a fascinating woman, a socialist and a journalist and a researcher who was working at the turn of the century, who I write about in the book, Crystal Eastman. She was gone to Pittsburgh, and she was the first person to investigate the problem of accidental deaths as a crisis. And at the time, where today drug overdoses and falls and traffic crashes lead accidental deaths, at the time, workplace deaths were the core of the problem. And hundreds of thousands of people were dying in workplaces. Just to give one example, in one job, which was a railroad car coupler. So the job was to connect and unconnect the railroad cars. This was a very dangerous job. But in that one job, in 1 year, 11,000 people died. Not everyone, not in the railroad industry, 11,000 people died, just doing that one job. And so what we're talking about here, and as an example, around 5,000 people are killed in their jobs by accident in the US today. So we're talking about massive numbers. And Crystal Eastman, she goes to Pittsburgh to try and figure this out. And she gets from the morgue the record of everyone who was killed by accident at work. And she investigates them all. It's 500 people. And she tracks down people who were there, who saw it happen. She talks to their coworkers. She talks to their families. And she breaks down data, like real data that she was producing in 1909 about what had happened. Because the story that employers told again and again that these workers died because they were drunk or dumb or they weren't paying attention. They didn't read the sign. But the truth was that they were doing incredibly dangerous work on unguarded machines. There were no safety regulations. They had no protections. And they were, to their employers at the time, because this is pre-workers' compensation, totally replaceable. And what Crystal Eastman wanted to do, and what she ended up doing with this data, was to move beyond what at the time she writes about. She was writing at the time of the Monongah mine disaster, massive mine explosion, hundreds killed. And she was like, this Monongah mine disaster is going to take our attention for weeks. But, you know, in the newspaper every day, one man is killed from falling shale. And we don't actually even cover it in the newspaper most of the time because that's not news. But those ones and twos add up. And so she counted them all up and started to make the case for workers' compensation and real regulations that finally forced factories and corporations to protect the workspace. And we've seen the results of that. That's a place where we've proven that, you know, this thing that we call random and unpredictable, this accident, is wholly preventable because those numbers have been driven down wildly.
So there's something that you said, and I don't want to get too far away from it. I want to be sure that we talk about it. You said the words were something like the story that the owners told or the story that the companies told. And because this is a series about health storytelling, I really want to pounce on that. I think that a really important strand of your book is this sense of how we narrativize accidental death and who gets to tell the story which is usually not just the survivors, but the employers, has framed accidental death for us in a way that isn't actually true.
I mean, I think that's spot on. And I want to tell you about like a few big stories of that, but I also want you to remember what I just told you about the ones and twos. You know, and it's easy to tell these big stories. We get a lot of information about them, but I want you to keep in mind the single drug overdose and the single traffic crash where the only person telling the story is the person in the other car, or maybe no one. And just keep those in your mind. But the truth is, when we talk about these so-called accidents, the winners tell the story. And I cite two fires in the book that really get at this. One is the Hamlet chicken processing plant fire, which occurred in 1991 in North Carolina. 25 people were killed. They were killed behind locked doors of a chicken processing plant, burned to death. The other is a fire you might know, the Triangle Shirtwaist Factory fire in 1911. 146 people killed in New York City. They were killed behind locked doors. Now, in both these stories, if you had listened to the owners before or after the fires, they would have said that the workers died in the fires because the workers were thieves. The workers were stealing, so the doors needed to be locked. And there was no system for checking these workers, and no system in different ways. Like the state OSHA in North Carolina is wildly underfunded and never inspected the factory until after everything had gone wrong. And those protections didn't exist in the time of the fire. But if you only listen to the owners of these factories in the story, then not the survivors, if you never investigated, you'd think that the problem in these fires was bad people. And there's some psychology going on there that might make you say, oh, well, they're bad people and they met a bad fate. That kind of makes sense to me. Like, even if you wouldn't think such a horrible thing out loud, we have a tendency to want to justify when terrible things happen because it makes us feel better. There's another fire example I wanted to bring this to that's more recent, just to prove, you know, I tell stories from history, and my biggest point is it's still happening. It's still happening. In New York City, where I live, in the Bronx in 2022, just 2 years ago, 17 people were killed in an apartment fire. And immediately after the fire was started from a space heater, and it spread through the building. Now, immediately after the fire, the mayor and the police commissioner got on TV, and they said, this fire happened because someone used a space heater irresponsibly and because they didn't close their door when they ran from the fire. You have to close your door. We're going to invest in PSAs to tell people about how they have to close their door when they're running from a fire. Now, in New York City, we have strong building regulations, including two laws. One, which require buildings to be heated above 68 degrees in the winter, and another that requires large apartment buildings to have self-closing doors. Now, these are safety regulations built in. They're great safety regulations because they're built in the fact that people need heat to live. Space heaters are dangerous. You don't want people using independent heat. And when you're running from a fire, you're not thinking about closing your door. Now, this building should have had adequate heat, so no one needed a space heater, and it should have had adequate self-closing doors. But an investigation later found that the heat was both malfunctioning and the self-closing doors were broken. And so the story was told that the problem here was bad people who didn't follow the rules, when in fact what was happening was there was a terrible corporate landlord for whom regulations weren't enforced by the city of New York that directly led all of these people to die. But it was comforting, I think, even for the mayor and the police commissioner to tell that story to us in the time. Obviously, they were letting themselves off the hook. These people who died, they died by their own hand, not from our failure as a government. But it was also probably comforting for a lot of the people who were listening, who were saying, wow, I don't have to feel as bad about this horrible thing that happened because I can blame someone.
So there's two things in that story. And I know you have a couple of big stories that you want to talk about, and we are going to get to them, but big and poignant stories. But the thing that strike me in the story that you just told, the first is that, and you talk about this in the book, about how we expect people to be perfect, that both our expectations of people's vulnerability to accident and also the ways that we structure the situations in which accidents occur rely on people doing everything completely right all the time. And people are human and they don't. And so we find a way to assign blame to them. But the other is, I'm going to guess here, if those people were running a space heater and they were in a building that was not heated to the statutory level, they probably weren't living on Billionaires Row down by the park, right? Like they were probably disadvantaged people in some manner. So I wonder if you can talk about this sense that first, the incredible burden of accident on people who are not as advantaged in US society. And then what it says that we expect people to behave perfectly, even in moments of emergency. And we sort of tilt our policies toward that direction.
I feel like that latter question is harder, but let's start with the data. This is a lot of what drove me to write this book, to realize that this was a book, which was when I started to look at the numbers. I had some awareness that there were some racial discrepancies in traffic crashes, but I started to look at the numbers nationwide across all these things we called accidents. And there are racial and economic corollaries again and again and again. And, it's not everything we call an accident. It's just the ones where physical infrastructure, the built environment of our society could actually protect us. So, for example, across the US, everyone chokes on food at about the same rate. And that's because there's not much that policy and infrastructure that government can do, that corporations could do to prevent us from choking on food. But if we look at those areas where protection does matter, for example, Black people are killed in house fires at more than twice the rate of white people. Indigenous people are struck and killed by drivers at more than twice the rate of white people. People in West Virginia are killed in accidents at more than twice the rate of people just across the state line in Virginia. And of course, West Virginia is a very poor state. Virginia is a relatively wealthy state. What we're talking about here is the difference between whether you have access to safety or whether you don't. And a lot of the way you can look at this, it's not, I think this is the most important thing. When I talk about intention and how we look for an individual to blame, what we're doing there is we're trying to minimize this horrible thing, this thing that scares us, to one cause, a bad person, because then we get to feel better, right? I found the one cause. It's a bad person. I'm not going to be like them. I'm safe. And what we could do is that, instead of, doing that work of separating ourselves, the reason I talk about intention so much is because it's not just one person. It's not just one thing. It's how danger stacks up. So, Black people are more likely to be killed in traffic crashes. And that's because if you're a Black person, you're more likely to be living in a formerly redlined neighborhood. Neighborhoods were redlined to advance the US highway system, which means you're more likely to be living near a highway. And people who live closer to highways have more drivers near them who drive at highway speeds. So you're more likely to get hit by a car. But you're also more likely to live in a place without sidewalks, because statistically, infrastructure and spending is lower in Black neighborhoods. Same for streetlights. So think about how we're piling up risk here. Drivers are driving faster near you. There's no safe place to walk. There's less likely to be light. You're also less likely to own a car which means you're less likely to be able to drive in a big steel cage from one place to another and to have to walk. And so when we say Black people are more likely to be struck and killed by a driver, it's not that any individual driver or any individual pedestrian is somehow, acting in a way that is causing this, but rather that we have built or failed to build safety systems in a really inequitable way across our country.
So we're almost amazingly halfway through the hour now. And so I want to be sure to remind everybody who's watching and listening to us that we would love to hear comments from you. If you are watching us on YouTube or on Facebook, you can comment in the comment boxes. We will see them here. If you are watching this on our Twitter account, then reply to the Twitter account. Again, we'll get the comment. We're very sorry to the people on the other platforms. And in the second part of the hour, we will start to look at those questions and see how many of them we can answer. So please don't forget to ask questions. There are stories that you have already mentioned that I want to be sure that we get to because they are so poignant and so important and so illustrative of the reasons behind accidents and also the levers that move policy around accidents. And the one that you mentioned to start with is the death of your friend Eric. So please tell us about him.
Yeah, absolutely. Eric Ng was a New York City high school math teacher. He was a really funny, really sweet guy. He was my best friend, my high school sweetheart. And in 2006, he was killed by a driver while riding his bike on the West Side Greenway of Manhattan, where we both lived. This is a separated biking path that runs along Manhattan Island. He was killed by a driver who had mistakenly turned and entered the path. And the driver was drunk and speeding and went to prison. And for a long time, that was the end of the story. It was just a tragedy, an accident, a crime. Didn't really matter. It was over, right? But the thing that drove me to write this book, to investigate this idea, happened 11 years later. A different man, 11 years later, rented a truck. And he followed the exact same route as the man who killed my best friend. He entered the same place, drove downtown, except this man intentionally turned onto the bike path. He killed 8 people and injured 11 in active vehicular terrorism. And I remember being so shocked that the same thing had happened again. Sort of, right? It was the same thing if you looked at it through one lens. It was the same mechanism of harm. It was the same location. But then if you looked at it a different way, it was totally different, right? Because the intention was different. And it drove me to look at the place where my best friend died. And what I found was that other people had been killed and severely injured there before and after Eric's death on the same path. Now, the drivers in these crashes were different. Some were distracted, some were lost. But every time a driver ended up on this bike path, the story told was it was an accident and no problems were solved. Now, the truth was that you could enter this bike path at every intersection of the road. It had a double yellow line running down it, like every road in America. And there was nothing to make you think you were in the wrong place, really. Now, after the terror attack, things changed. It wasn't an accident anymore. And so the city got together with the state and they put bollards at every big steel poles at every entrance to the bike path. So you could still bike on it, but you could no longer drive the car down it. They made the harm impossible. They made the terrorist attack impossible, and they made the mistake impossible. And for me, it was this realization that by calling all of these accidents, we were committing a sort of willful ignorance. Accident was this magic word that let us say that preventable harm was random, special, unique, never going to happen again just like that, even though it would happen again and again and again. And so it was that drove me, just as a journalist, to start to look into the numbers. And that's where this book came from.
Do you think, because obviously you've thought about what's alike and different about these two stories, and I'm so sorry for the loss of your friend. Was it the volume of death on the day that the people were deliberately mowed down that made the city or the state pay attention? Was it the intention behind it? But what made it possible for them to say, "Oh no, we know this isn't an accident. This is different"?
It was practically, it was clearly like a motivated terror attack, and they caught the person who, I think confessed. But I think like the factors there was partially the death toll, but I actually think it was much more that it was intentional, that someone took advantage of these, holes in the safety system. And then suddenly everyone felt unsafe. Where before, I think they were deluding themselves too, that this space was safe and accidents just kept happening. I think that's the most important thing to understand, that like accident is a word we say to comfort ourselves, even when we're the mayor, even when we have power, because, it takes something off our plate. It says like, this is not a problem that needs to be solved. This is just a thing that happens. Now, there are malicious actors here who take advantage of the ways, we see accidents. I mean, certainly the owners of the Hamlet chicken processing plant and the Triangle Shirtwaist factory fire and countless other corporations take advantage of the way we want things to be oopsie instead of preventable. But I also think that like it's something we do because it makes ourselves feel better.
It's so interesting to me, and tell me if I'm going too far with this, that it was the intentionality behind this act that in addition to the death toll, that made it remarkable and different to the authorities. Because I think you could argue that in other forms of accidental death in the US, there is also intentionality, or at least willful neglect. I'm 5'4", and I recently stood next to a pickup truck, not the largest pickup truck on the market. And the top of the hood was about equal to the bridge of my nose. I would not have been able to climb into it without the extra step that they had installed in order to get shorter people like me into the cab. There are in your book so many examples like that of some intentionality on the part of a corporation, of a regulatory agency, of a municipality, where if they had not come out and said, we are going to intend to kill people with this action we are about to take, they certainly haven't backed off from it on the possibility that death might occur.
Yeah. I think there's a lot in this country, especially, of like freedom to die and get killed. And what's being called truck bloat and car bloat is a great example. The size of SUVs and trucks, the footprint of them has increased massively in the last 10 years. And it's directly driving a pedestrian death crisis, for exactly the reason you said, that the driver can't see you. And what's happening for the car companies is they can sell those big cars for more money. They can turn them over quicker. And, I don't know about you. I know I live in New York City, so I don't drive. But if I lived in a place where I drove and I was on the road next to those big cars with my family, I would feel pretty scared and think maybe I should get a giant car too, because it's an arms race out there, and people in the Kia are going to get killed. And I think that's an interesting point to get to when we talk about accidents, we talk about like kind of classes of victims. Like obviously a pedestrian is extremely vulnerable. A cyclist is extremely vulnerable. But something we forget about is the way that, race and class make us vulnerable in different ways. Like if you don't have a lot of money, then you're not buying a Ford F-150. You're buying a little tiny Kia. And that Kia is going to be on the road with a Ford F-150, and it's going to lose in a crash every time. And so we often talk about like the drivers are protected, but they're, the way that class and poverty affects how much you can protect yourself gets into every point of these things. And because the automakers are making dangerous vehicles and the regulators aren't forcing them towards safety, we see even the best safety technology is something that just rich people can buy. Like automatic emergency braking is something you can have, and that will like totally save your life in a speed related crash. but you have to pay extra to get it. So only rich people are protected.
So there's one of the episodes in your book. I live in Atlanta, and one of the episodes in your book happens here, and it illustrates so well what you've just been talking about. And I would love to hear you tell that story about a woman who lived with her children in a part of Atlanta. And this is not, I think of this as not a desperately poor part of Atlanta by any means, but a part of Atlanta where that is a lot of people's first homes in the city, particularly if they have immigrated. And where she lived, there were buses to take people back and forth who can't afford cars, but there weren't ways to get across the street. Tell us what happened next.
Yeah, this was a woman named Raquel Nelsons. She had 3 kids. She didn't own a car. She lived on one side of a 4-lane road, a highway. And to get to the bus stop, she had to cross the road. The nearest crosswalk was a 15-minute walk away. Not far in a car, but a 15-minute walk with 3 kids. And so what Raquel did was what most people in her apartment complex did, which is you ran across the street to get to the bus. One day, Raquel was coming home with her 3 kids. They had missed a bus before. It was late. It was getting dark. Didn't seem to be anyone coming. They ran across the road, and a driver struck and killed Raquel's son, AJ. And what was crazy about this story, beyond this horrible tragedy, was that the state of Georgia decided to not only prosecute the driver in this case, but to prosecute the mother for the death of her child. Those charges were eventually dropped, but it's indicative of this thing I talk about, where when horrible things happen, we're so desperate to find someone to blame, when the problem involves restructuring the system and putting aside this horrible driver in this crash, and this mother who suffered something horrible, and looking at the place where this happened. A whole apartment complex worth of people who need a bus, not a traffic light, not a crosswalk, an unreasonable expectation that they'll walk far out of their way, a time cost, that affects poor people differently than rich people. And after the crash, the city, the Metro Transportation Department went out and they counted the number of pedestrians who ran across the street and decided it wasn't enough to install a traffic light and a crosswalk. And what that tells you, it tells you a lot about how we prioritize cars over people, about how we prioritize white people over Black people. Raquel Nelsons was Black. How we prioritize, the wealthy and the poor, and who actually our streets are for and our infrastructure is for and who it's meant to protect. It's a horrible tragedy that really gets at the inaction and the levels of exposure to danger that so many people face, and that we, often miss out on paying attention to because we're so focused on the individuals in these stories rather than the systems that we all face that put us in danger.
So I think now might be the time to try to talk about how we fix some of this, or whether there are solutions to this, because you're very clear in the book that capitalism is driving so much of this, and that the regulatory agencies and the courts, whom we'd expect to put some curb on unbridled capitalism and its effects, may not be doing the job that we believe that they are doing. So where are the levers? What is the possibility of pulling some of this back and making the built environment and the work environment safe for the most vulnerable, as well as those who behave perfectly?
I think something I like to talk about, what we're talking about here is a reconception of how we look at our world, right? And so just to speak impractically for a second, look at the roads are a good example. So for decades, we considered traffic accidents to be caused by bad drivers, the proverbial nut behind the wheel, right? But nothing changed until we changed cars. We put seat belts in them and shatterproof glass and padded dashboards. Now, seat belts and shatterproof glass don't prevent human error. People still drive badly. It just prevents harm. It prevents the death, the injury when we inevitably screw up. And so I like to lead with that as an idea. We know about all this stuff. The bollards that could have protected Eric, the self-closing doors in the fire in the Bronx, the naloxone, that is the difference between an accidental overdose and an accidental overdose death. These are all forms that exist, in these disparate accidents under different names. In transportation, they call it the safe systems approach. In health, they call it harm reduction. But beautifully, even though these systems have developed differently in different fields and are being used to save lives in other countries, they all follow the same rules, which is don't try to change people, give up on behavior. Instead, cushion the blow, install a fail-safe, put a barrier between people and harm's way. That's what a bollard is. That's what a self-closing door is. That's what a naloxone is. It's a thing that protects you when you screw up. It's a system that accepts that people are imperfect and plans for people to make mistakes. It makes the consequences of errors less severe. I like to say that we need to build foolproof systems in the sense that we assume people are fools and build for them, so that foolishness or mistakes or bad decisions are not death sentences. And so we're in a system now for a long time. All those seatbelts I was talking about came from a remarkable moment in this country that started with Crystal Eastman and reached a crescendo and then quickly ended in the 1970s, after the 1970s with Ronald Reagan, where we built a regulatory system to do exactly this, to protect us from corporations, profit margins, and their drive to do anything it takes to make money, even kill us, and also other people's mistakes, to build safety into the system. And some of those regulatory, in general, Reagan defanged and defunded those regulatory agencies, and pretty much every president has followed, though Biden's been doing some good stuff. And some of them are still trying, like OSHA, and can barely keep up. But most, like NHTSA, the National Highway Traffic Safety Administration, are simply rubber stamps for the industry they're supposed to protect us from. Like that giant truck you stood next to, I guarantee that giant truck has a 5-star safety rating from the National Highway Traffic Safety Administration, even though it is far more likely to kill you in case of impact and far more likely to kill someone in a smaller car. That wasn't very hopeful, was it? But I'll give you this. This is not rocket science. The U.S. leads the wealthy world in accidental death. We know how to do this. These are wholly solvable problems. But they do start with us accepting that they're not accidents, what's happening here, and that we do need to look at the hard truth that, we're actually not safe. And finding an individual to blame isn't going to make us safer. And we have to start to fight for building systems. And look, you can do this on the local level. The federal government's a mess. Advocate for public transit in your community, because that makes fewer people are on the road if they can take the bus. People are less likely to have DUIs if they can take the bus. They're more likely to get where they're going safely and not harm anyone else if they're not an individual in a car. Fight for safe injection sites and naloxone access wherever you live, and learn to use naloxone and carry it with you, because then you can help arrest an accidental disaster. Fighting for ADA compliance in your office and in your building means anyone's less likely to take a fall. Looking at fire safety regulations for apartment buildings where fires can spread quickly, like heating limits and self-closing doors, reduce the likelihood that a mistake with a space heater, well, first, that mistake ever happens because a building's properly heated, and should it happen, that fire doesn't spread. So I feel like always looking for places that locally you can change the built environment and change how your city, your town is looking at safety, especially when things go wrong.
It's really striking that the US does this so badly. when we think of ourselves as the richest, the most comfortable, the most advanced nation on the planet. As you were doing your research, did you find other places, either cities in the US or societies outside the US, that have tackled these challenges and made significant change?
Oh, yeah. I mean, everywhere is better. I mean, everywhere in the wealthy world is better than at us than this. Our accidental death rate is massively higher than everyone else's. And so you can look to, actually, there's a great article in the New York Times today about what Portugal did to reduce overdose deaths. And it gets at why some things are a little more complicated here, but it also gets at the ways, it's talking about San Francisco, but like the ways we're getting it wrong. And Portugal, in the process of decriminalizing drugs, using a harm reduction approach that didn't try and get people to stop using drugs, just tried to get them to stop dying, and providing them with real resources, tackled a massive drug problem there. If you look to places like Sweden that are implementing a safe systems approach, they've cut their traffic fatalities in half while they've been rising in the US in the same 20-year period, skyrocketing. And they're all doing the same thing. That's a safe systems approach, a harm reduction approach. It's the same idea. It's saying, this isn't about who made a mistake. This isn't about a PSA to tell them to not make mistakes, or a summons or a jail sentence to punish them for making a mistake, or a bad decision or an error, whatever you want to call it. It's about saying, okay, how can we protect them even though they did this? And I think an important thing to look at with that is about systematizing it. I think, we do patchwork safety here in the US, a regulation here, we fix a road there, a safe injection site program in one city, but not in the other. And the problem with that is that there are still all these holes in the system. Even though we know that the way that people drive, the way that people use drugs, the way that people keep themselves warm when they're cold is the same everywhere. But we don't ever universalize safety. We fix one road, but then the road that looks just like it, usually we fix one road where a person died, but then the 7 other roads that look just like it, we don't do anything about those. Or in a worst case where you live, they don't do anything, even when someone dies. So we're just looking at this incredibly patchwork system of safety, which is why I come back to federal regulation and the need to fight corporate capture of federal regulation everywhere we can, and call out the ways that our regulatory agencies need to be better funded, but are also failing when they're in bed with the corporations that they're regulating. I mean, you look at these Boeing planes that are getting certified as safe by the FAA, and you say, why? And then you see how many people move in a revolving door between Boeing and the FAA, and it starts to make sense.
At the end of the book, you talk, and it's a very poignant moment, about being fueled by love and rage to want to do something, in your case, but to write this book, but to respond to your friend Eric's death. But you also talk about other people, most of them women, who were moved to create community movements or create organizations or begin to lobby because of tragedies in their families. And while on the one hand, I think that's lovely, and I am confident it is a comfort for them, it's a little daunting to realize that it is individuals or small community organizations pushing back against this enormous trend. Is this the best we can do? Is this the only a small group of motivated people can change the world? How do we fix this?
I mean, I think that the women I talk about in the book inspire me because they've done so much with so little. Mm-hmm. Lost everything, scraped together something, put a little change out in the world. And I do think that's really important. But the big stories, I talk about this in this book, Crystal Eastman, for example, Ralph Nader. Now, these are people like you and I, curious people who dug in on an idea and read and connected dots and then wholesale transformed systems. I mean, Crystal Eastman is largely responsible for the idea that we have a workers' compensation system, which is the singular factor that keeps workplaces safe, along with unions. God bless them. But her work brought that idea that we were blaming workers for their own deaths, that we were calling them dumb and not reading the signs and not paying attention, and they didn't read English, and actually proving that their deaths were a direct result of how fast the assembly line moved, how unguarded the machines are, how many hours they worked. And then we're able to systematically change those conditions and put a cost on those deaths so that corporations were no longer so willing to easily kill their workers. Look at Ralph Nader. It's the exact same story. He dug in and investigated these ideas that people seem to already know, that the cause of traffic crashes was certain parts of the car. And there were scientists studying this, but no one was talking about it. And he took those ideas. He took these scientists who had been, politely handing their ideas to the car companies and saying, these are the most dangerous parts of your car. People are dying because the steering wheel doesn't collapse, and the car companies would say, oh, thank you so much, and never reply. He took their science, broadcast it to the world, got it to Congress, and created the National Highway Traffic Safety Administration, which brought huge advances for some time before Reagan, to make people inside cars safe. So I do think that there is a lot of potential here for sounding the alarm, for drawing attention to what's going wrong here, and to, bringing light to the ways that we're all exposed to danger and we're all being persuaded to tell a simpler story, that these people are dying because they left their space heater on or they ran across the road, not because danger is built into the system in which they live.
That's a wonderful summation. Thank you so much. I guess what we can hope for is that there will be other people who come along, and I hope your book does this also, and have the leverage and the data that moves us toward changing systems. It sounds like that's what we really need. Thank you so much for this discussion.
It was a real pleasure to join you. Thank you so much for having me.
So that's it for this episode of the Health Storytelling Author Q&A series. Please consider following Jessie on social media. You can find her as Jessie Singer NYC on Twitter or X and Threads, and just Jessie Singer on Blue Sky. And buy her book, which you can find at the site of her publisher, Simon & Schuster, and at Amazon, of course, and also at bookshop.org, which is the anti-Amazon. It's a B corporation, a social corporation for good, that will accept your order for the benefit of independent bookstores, which is a thing that we love. And if you actually like going to bookstores, which we hope you do, we urge you to follow the link we provide for indiebound.com. That site will show you which independent bookstore near you is carrying Jessie's book, and then you can go get it yourself. In future weeks, as I told you, we'll hear from Teresa McPhail about Allergic, Our Irritated Bodies in a Changing World, and Christine Yu about Up to Speed, the groundbreaking science of women athletes. This series is hosted by the Center for the Study of Human Health at Emory University, co-sponsored by the Georgia Center for the Book, Science Gallery Atlanta, and the Decatur Book Festival. On behalf of all our sponsors and from me, thank you for watching. We hope to see you next month.